Hi, it's Dr. Tara Scott from Revitalize. So what exactly is functional medicine and what is integrative medicine? Functional medicine is something that looks at the root cause of a symptom. So for example, in the traditional world, let's just say that you had a stomach ache. In traditional medicine, what they do is they have to make sure that you don't have cancer or something really serious, which is great. If you don't have one of those things, then the treatment is aimed at your symptom. Your stomach hurts, why don't you take this medication? And if you take that medication for your stomach being upset, then maybe there would be another side effect of that. But you don't really stop the reason for your stomach ache. The other thing that we do is we try to treat the cause and make a difference in the outcome. So for example, say you came in and you had high cholesterol. What the traditional medicine would do, if it was high enough that they were concerned, is they would put you on a cholesterol medication. So let's just say you take that cholesterol medication and now you have some aches and pains that are caused from that medication. And so now you're going to take some Advil or some ibuprofen. And because of that, now you have some reflux, gastrointestinal reflux. So you go back to your doctor, you're on the cholesterol medication and the Advil, and they put you on a protein pump inhibitor like Prilosec, and then now you're on that. And now because you're on that, you get a bacterial overgrowth of your gut and you get other symptoms, and so on and so on. Treating the symptom doesn't change the cause. So in functional medicine, if you came in with high cholesterol, what we do is we'd say, well, let's take a detailed look at your diet. You may think that you're eating the right foods, but they might be not the right foods for you. We would take a detailed health history about other things like how much alcohol and caffeine you drink and how much you exercise. We'd look at your family history. We'd look at potentially at your genomics and your genes. Do you have a genetic predisposition to that? And lastly, we'd look at your hormone balance. Cortisol is a hormone that is elevated with stress and absolutely can affect your sugar metabolism and your cholesterol. So looking at the root cause, then we develop a health plan for you and think about how we could get you an optimal wellness. You don't just wake up one day and have diabetes. So instead of waiting for your blood sugar to be high enough to get a named disease, in functional medicine we start looking at the trends and think, you're on the way to diabetes, it's time to act now so we can get your optimal wellness.